Welcome to the Increda-dental podcast. I'm your host, Alicia Flynn. Our goal is to make a positive impact in the dental field. I have been a dental assistant, a biller, an office manager, a scheduler, a hygienist, and a dental coach, which makes me your biggest fan. My husband was in the military and we traveled all over the United States. I had opportunities to work in many different practices, and I saw incredible practices and practices that had a lot of potential within them. Thank you for joining us. Let's dive into the podcast. Welcome to the Increda-dental podcast. I'm your host, Alicia Flynn. Today, we're focusing on helping you connecting with your patients to have a more meaningful and effective conversation. We're diving into the crucial aspect of patient care and how to uncover what lies beneath the surface of the patient's concerns without making the patient feel uncomfortable or caught off guard. And so when we seek this information, it's easy to fall into that habit of asking the patient, do you have any teeth bothering you? While this is a straightforward conversation, it can often be too abrupt for the patients. They might feel pressured to answer quickly and dismissively and say, no teeth are bothering me. But as dental professionals, we know there's often more going on beneath the surface. And it's kind of like unwrapping a gift or taking a sneak peek at a gift before Christmas Day or your birthday to see what's inside. So to better serve our patients, we need to guide the conversation more thoughtfully, creating a space where they feel comfortable sharing their concerns. And this approach not only helps us gather vital information, but it builds trust and it builds rapport. So how do we do this? It starts with asking open-ended questions that encourage patients to talk about their experience and their feelings instead of diving straight into the specific tooth question or do you smoke, do you chew? We need to widen and ask broader, open-ended questions. So a couple ideas are, tell me how you take care of your teeth, or do you have any issues with dry mouth? And then from there, I'll ask, have you noticed any sensitivity when you're eating hot or cold foods? Or do you use a CPAP machine? These questions open the door to a deeper conversation, allowing patients to share more about their oral health and challenges they may be facing. It's about getting to know them gently and allowing the patient to guide us to what's most important to them. Now, there are other questions we can ask about their feelings, about their smile. And you can ask, what do you like about your smile? Or is there anything you would like to change about your smile? And do you have any problems eating any certain foods? These questions not only give insight into the dental health, but they also the patient's self-perception and satisfaction with their smile. And this knowledge can be incredibly valuable in guiding treatment recommendations that align with the patient goals and what they desire. Now, once we've gathered this information, it's essential to ask for permission for providing advice or for asking more questions, more in-depth questions. Sometimes I'll ask, can I give you a few ideas? And that can make a big difference. It shows respect for the patient and ensures that they're ready to hear and that they're ready to apply what you might have to offer them. So sometimes I'll ask patients if they wake up with a headache or sore jaw or neck or shoulders. And then we talk about grinding their teeth and what might be causing that. Other times we talk about if they're unhappy with the color of their teeth. We'll ask them, how long have you been unhappy with the color? Were you happy with your color of your teeth when they first came in? And we seek out what's going on in their diet, maybe what's going on with their smoking or chewing, what might be happening that may cause them to be unhappy with their smile, and how we can help them. As we go into this conversation, you can have this at any time during the treatment. Sometimes I'll ask patients while I'm getting the x-ray machine ready some of these questions. And other times I'll do it after I've done the evaluation, after I've done the full mouth probe, the x-rays, I've looked around their mouth, I've done the oral cancer screening, maybe I've done some intraoral pictures. And then I'll tell the patient or ask them, I noticed this area is bleeding here. Did you know it was bleeding? Have you had problems there? And often the patient will say, yeah, I have had problems packing food there. Or, yeah, that area has been bleeding when I'm brushing my teeth. And it lets them know I'm customizing their care to them as a patient. Patients like to feel that they're being cared for, and they appreciate it even more when we, as clinicians, customize their care. This is really good for dental assistants and hygienists, but also for the dentist in the new patient exam. Because when we build this trust, when we build this rapport, it moves the patient forward to care because they feel cared for as an individual. And our goal is to make our patients feel heard and understood, not rushed or overwhelmed in their treatment, but by gently guiding them through this conversation, we can uncover the true nature of their concerns and provide the best possible care. So choose out what questions you want to ask your patient. Practice them, have them written down. It takes time. And sometimes I even get back in that habit. Do you have any teeth bother you? And I just want to kick myself when I do that. Don't ask that question. Ask smarter questions. Ask questions that may be regarding their smile or whether they're chewing, but in a gentle way, so that way you open the conversation to educate your patient to the best health possible. Because when we have a healthy patient, we have a healthy practice. Thanks so much for joining me. Have an amazing day.